Friends, in last video, which was the part 1 of what to do when your patient is not following your treatment, when the patient is not agreeing with your treatment and patient is arguing with you for immediate relief. The last video was part 1. Now we will see the part 2. As I explained you in part 1, there are 3 elements: you as a doctor, patient, and third element is patient's relative. So now we will see how to tackle patient and patient's relatives. Okay. See now the patient's mentality. What is the patient mentality? Patient mentality is only one thing: go to doctor and get well. Go to doctor and get well. There is nothing like take medicine or follow doctor's advice, or if doctor has told any diet restrictions, then follow that diet restrictions. No. I have come to your hospital, so I should be cured. Patient mentality is that they don't want to do anything from their own side. डॉक्टर के पास आया तो नाउ एवरीथिंग यू हैव टू डू, अभी आप ही हमारे भगवान हो बस. पेशेंट टेल्स डॉक्टर, अभी नाउ वी हैव कम टू यू, यू आर माय गॉड एंड यू ओनली क्योर मी. बस दैट्स व्हाट इज हैपनिंग. सो हियर you have to manage the patient in a very tactful way. Whenever a patient comes to you and you suppose you have told patient it will take 3 weeks for your treatment, patient is surprised what kind of doctor you are. The other doctors, they are telling me I will get cured, I will get well in 1 day, and what type of doctor you are? Probably you are not a good doctor. So you have to counsel the patient. You have to go into the lifestyle of patient. Find out what patient is doing right from morning till night, and find out the negative points 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Find out 10 negative points in his lifestyle. He may be smoking, he may be drinking, he may be alcohol, or he may not be sleeping well, he may be having tension or a job, or he may be doing work from home. Find out. And when patient is telling no, you remember all those 1, 2, 3, 4 negative points. Once he finishes, you tell the patient, regurgitate. This regurgitation principle is very important to become happy doctor. Take it in writing from me. Regurgitate all negative points in front of him and tell him, see, you are doing like this 1, 2, 3, 4, 5, 6. How can you get well? You are doing all those 1 to 10 negative things. How do you expect me to cure you in 1 day? If you find any other doctor, tell me his address. I will send all my patients to that doctor. Tell him you have to cooperate with doctor's treatment. Now the patient is going to get convinced. Now he knows that how fault he is having in his own self. Third point is relatives. Sometimes the relatives are there in your consulting, or sometimes the relatives are at home and only patient is coming. Then what to do? Now you have to play little bit counseling tricks. You have to judge whether patient is getting satisfied with your consultation or no. If you think patient is getting satisfied, then no problem. If you think patient is not understanding the impact of what you are telling him to do, then tell him who is the senior person in your house, or ask him who is in your family who is looking after your well-being, your health. Bring him to me and I will explain along with you to both of you. Don't waste your time in explaining that particular patient if he is not ready to understand. Tell him to bring relative in front of you, and for that particular second consultation don't charge, okay, because this consultation itself is your half. So in next consultation when the patient brings relative, then you explain both of them at one time, and then patients will understand. Again remember, you have to create value for yourself first, in front of relative, in front of patient, in front of both. Then you create value for your prescription in front of relative, in front of patient. Then you give to them. One thing I will share with you, or you might have paid attention to. See, now many corporate people, many MR, they might have visited your place, or in any meeting you might have visited any big celebrity. How do they give their visiting card to you or to anybody else? How do they give visiting card? They don't just give it like that. They give it that as if they are giving 2000 rupees note, they are giving you the card. You must hand over your prescription like that. I will tell you what is routinely done. Even I used to do like this 10-12 years ago, but not now. What we do? Suppose this is the letter pad, okay, so RX, no, forget this habit. When you want to become happy doctor and you want to make your patients happy, then cultivate happy habits, cultivate good habits. When you finish writing, gently remove that paper, put it in envelope. If you don't have envelope, then fold it and hand it over to patient like this. Tell him this is very important. Tell him you have spent 100 rupees, 200 rupees or 1000 or 1500 for this paper. This is nothing but your 1000 rupees worth paper. So preserve this well. Create value for yourself. Of course, when you join our Happy Doctor Foundation and our Practice Mastery Growth modules, we call it 10-in-1 PMP, Practice Mastery programs, that time you learn all these intricacies, and believe me, your success lies in details. Each and every step you take, each and every word comes out from your mouth, that determines your future. Up till now, whatever you are doing, you have reached this particular stage. If you continue same methods, same practice strategy, you will remain at same place. You will never scale. So, if you want to develop ethical practice and still grow your practice, then I sincerely request you to join Happy Doctor Foundation, subscribe to our YouTube channel, Facebook group, Telegram group and WhatsApp group. So see you in WhatsApp group. Bye. Thank you.